Hare Krishna Madhavananda Prabhu. Please accept my humble obeisances. All glories to Srila Prabhupada.
Hare Krishna, Gopal Bhatta Prabhu. Thank you very much. Please accept my humble obeisances. All glories to Srila Prabhupada.
We're very, very happy to have time with you, and I know that you're quite busy, so for you to spend this time with us is very important. We have a worldwide constituency of devotees that listen to our GBC Strategic Planning Team interviews. This interview being very important because of your position as a doctor, and more so as one of the key members of the Bhaktivedanta Hospital. So I would like, I think pretty much you're a very famous person, actually. But
I don't know.
Oh, yeah, you are. Everybody, the hospital is quite appreciated by the devotional community. And so many people know you, but still there may be some people that don't know so much of your background. And if we could just take a few minutes, tell us how you joined Krishna consciousness and how you and your family's devotion proceeded, and just give us some of that background.
Okay, thank you. Pranams to all the people who are watching this. I graduated from the Mumbai's Grant Medical College as a MD in Pediatrics, and in my graduation days in the year 1984, that is the first time I went to ISKCON Juhu Temple, and that's where I came in contact with the devotees. And then in 86, I accepted initiation. And at that time, I just graduated, and we were, few of us, other people from other medical colleges in Mumbai were also there. So 5-6 of us, together we were deciding how to go for post-graduation, and we chose our systems of post-graduation. So I took up pediatrics, somebody took up surgery, somebody took up orthopedics, somebody took up physicians, like that. So we created a team from the graduation days, so that we can have a setup which is together, because we didn't want to actually go into practice and earn money, and that was not the goal, because that is the mood at that, in those years in ISKCON. The mood was very clear that once you join ISKCON, that means you join only full time. There's nothing else in between. So you're like full time. So we were considering ourselves as full time devotees. So full time devotees means we need to do something for Prabhupada, for the mission. So that's how we thought of creating that hospital. And His Holiness Radhanath Swami Maharaj used to encourage us. And that's how we came together with the concept of a hospital. And then slowly through that concept, we were doing rural camps, and we adopted some villages. This is during our post-graduation days. And that became like a team who was working. And in 1998, we opened the Bhaktivedanta Hospital. At that time, we opened with 100 beds. And right now, we are 200-bed hospital, which is a multi-speciality. And we have practically all super specialties, including heart surgeries, cancer surgeries, neurosurgeries, ICUs, everything is there. And
so from the very beginning of your initiation, you and your small group of colleagues just decided the specialties that you would go into that would be needed for the care of the devotees.
Yes.
So you're basically a visionary from day one.
We are not. We are we were guided by Radhanath Swami Maharaj. So we have this, just to tell you how the concept of the hospital. We had these 3 concepts which were sort of the basis foundation of the hospital. We call it the 3 V's. One is the Vaishnava Seva. That means treating the devotees and serving them. Second was Varnashrama. That means in your own occupation you can serve. That's the principle of Varnashram, Sam Siddhir Haritoshanam. And the third was Vaishnava Dharma Prachara. That means preaching the glories of Dharma or Vaishnava Dharma. So
Mm.
these three P's are the foundation of Bhaktivedanta Hospital.
Mm.
So then we also got married to devotee girls who were also doctors, many of them.
Oh.
Like a surgeon got married to an anesthetist, and pediatrician me, I got married to a gynecologist. So like a complementary branches, and they also are part of the original team. And
So
this is
you
how,
you entered into pediatrics and you married a gynecologist.
yes. So that is how the initial years were there, and then through the association of devotees like Krishna Chandra Prabhu and many others, Radha Girdhari Prabhu, then Sachidanand Prabhu. They are like the business people. So we are doctors. We have skill of medical practice, but they have the skill of financial side and the
Mm.
other legal and everything. So that was a good combination, and the brahmacharis from the temple giving us guidance on the spiritual aspect. So that's how the whole unit of Bhaktivedanta Hospital right now is functioning with business people, doctors, and devotees. All three are part of the
So
sort of.
all of you were like modern day Murari Guptas.
Uh, we are trying to follow in his footsteps. That's what Maharaj also had told us, that follow in his footsteps.
Hare Krishna. Wow, what a story. That's just incredible. Has this ever been like really fully documented? Is there some
We are
book
trying.
that's been written about this or something?
We, we are right now compiling a book on, because we are now. I'm 58 now, so I'm about to now. In a few years, I'll have to retire. So the new batch of doctors who will come, they may not have the same understanding as what the original people had. So to preserve that legacy and preserve that missionary spirit, we are coming up with a book based on the instructions of Maharaj, the what the initial years were, what kind of decisions were made, how the present day structure has come up with discussions in various ways. How do we think as a management? So all those things are being documented. So that should be over in the next 6 months' time.
That's going to be a very important book, not just for the hospital, but for other projects. They can
Yeah,
use
it
that
can
as a
happen.
template. This would be a wonderful, wonderful book. So we are, of course, in this pandemic situation. COVID is really causing a lot of pain worldwide. And within the devotional community, we are also now being affected. We have had one of our GBC sannyasi gurus who we dearly miss, Bhakti Charu Maharaj, who has left. Gopal Krishna Maharaj contacted the disease. Thank God he's getting through that. Another GBC member, Chaitanya Chandra Charan Prabhu, also contacted the disease. There are a number of other leaders around the world, but then beyond that, we don't have a very good number in our head, but we're thinking by way of just putting all of the reports together in one place, there could be as many as 2,000, maybe even more devotees that have
Yes.
contacted this disease. So we're approaching you from your position as a doctor, and then importantly, as one of the primary leaders of the hospital, to help us understand what is needed. And I think maybe one thing that we can start with, if you don't mind, obviously the doctors and the nurses who are in contact with these patients, they have to be protected. So tell us something of what you're doing to protect your own doctors and your own staff. And we could start with that and then move to a couple of other points.
Okay. So I'll just tell you what happened in the hospital when the corona outbreak actually was imminent. Like it is like coming in, and the whole country was locked down. And that's the time when everyone understood that the corona is knocking on the door. It is still not, the cases are still in few hundreds, but everyone knew that, it is just a matter of time. So even in the hospital, our people were quite scared, many of them. But thanks to Srila Prabhupada's teachings and the atmosphere the hospital enjoys for all these years of having festivals of Vaishnava importance and regular prayers every day, and one at least one program of spiritual importance or spiritual direct spiritual topic attended by most of the staff every week. So those kind of things they have helped us to understand that we have to practice Gita. It's not just the speaking Gita, but practicing. And practicing means that means you have to do your duty no matter what the circumstances are. Karmanyavadhikaraste mahapadesha kadachina. So the fruit may be uh, positive or negative, and here it is definitely expected to be negative results. So even though there was a scare amongst the doctors, we we had several meetings with all our staff and doctors to first of all make sure that we understand what we are going to do. So we took that call with everyone being involved that we are going to do the best what we can in this circumstance. We are healthcare workers. We have to be in the front, but and Krishna is the deciding factor. Somebody has to succumb, so he'll succumb. But succumbing because of a casual attitude, that's very dangerous. If I have taken full protection, then something happens that we can see that there is a hand of Krishna or of destiny. But if I am careless, then I am responsible. So that is something which we instituted right from beginning. So few things which we did in the hospital for the staff and the doctors is one is that initial period there was hydroxychloroquine, which was a good preventive medicine because it prevented the virus from getting attached to the lung tissue. And so we started prophylaxis of hydroxychloroquine to every staff. We gave them N95 masks so that that is taken care, and everyone with gloves, and the some of them who are working in COVID area with PPE kits. So
and
this,
if I could just interrupt, the N95 mask is better than a regular mask.
yes,
Yes,
definitely.
definitely.
So N95 mask, particularly for healthcare workers, is a must uh, because we are directly in contact with patients. So it may not be required in the household thing or anything. There you can just somebody who has to go out and meet people. For him it is important, but otherwise it is not necessary. So N95 mask, physical distancing, repeated hand washing, and the PPE. These were the things which were taken care. Plus, we also started giving all our staff in the hospital twice a day a, a sort of a kind of a kadha they call. That means it is something which is like a, green tea, something like that, which was given to everyone twice a day free of cost, and which contained turmeric and many other herbs which are quite protective. So various things were done. Apart from that, we also wanted to make sure that our staff is assured that if something goes wrong with them, we will take care. So every staff contributed 10% of their income in 1 month, so that we create a COVID fund, and that fund was available to anyone. So anyone gets affected or his family member, then he doesn't have to worry. The hospital will take care of it. So no one is wondering where will I go, what will I do, where will I get the money. So everything was taken care by the hospital staff. And then there we created some rapid response teams in various areas where our staff were staying. And the job of rapid response team was only to make sure that they get the food in time, everything, because as soon as they get some COVID contact, they are completely isolated from the community. And the third was to give them continuous emotional support through phone calls and counselings, etc. So these were the few of the things which we did for our staff, and I would
So
say
that then set the basis and the mood but then to care for the caretakers was your
Yes.
primary first step. That's so smart. Yes, wonderful.
And
So,
because of that, I just want to add, and people sometimes think that we need to take this, that, but actually, we have stressed only on few things. Those three things: one is physical distance, second is a mask, and third is repeated hand wash. These three are the
mm,
most excellent kind of preventive measure, most excellent. And the fourth
mm,
thing I would add always in my all meetings is sleep well, sleep
mm,
extra, because sleep is an extremely good immune booster. If you
mm,
sleep well, your immunity is strong. If you don't sleep well, immunity goes down.
mm.
So that is also another thing which we made sure that people are taking care of it.
Some devotees, it seems, they even question the veracity of this disease, or the idea that maybe it's just a bad flu that people will get over. You see pictures of kirtans where people are not wearing masks, or they wear the mask on the mouth but not cover the nose. Uh, what do you think about this?
So being casual about it and thinking that we are already protected because we are in the temple premises and no one is coming out and going out, coming in and going out. I think that's a very dangerous kind of thing to do because the
Mm,
virus is everywhere practically in the whole world today. And these kind of little casual behaviors, they cause casualties. That's the whole problem.
mm,
Because,
mm,
somebody think that, I'm all right, I don't need to do it. I'm healthy. But a asymptomatic person can also transmit the virus. Today he's asymptomatic, but after 5 6 days he's symptomatic. So in those few days he has already infected several of them, and you don't know who's carrying the virus. So in all circumstances we must be careful. See, right now I am describing the situation to our whoever I meet, because we are interviewed very regularly on social platforms. So one thing is, it's like right now the whole virus is throughout the world now. It's not more, no more contained in a particular zone or anything. That zoning is no more irrelevant. It is totally irrelevant right now. It's everywhere.
mm,
So it's like a rainy day. It's raining. So when in raining, either you don't go out, but if you have to go out, then you have to take your raincoat, you have to take your umbrella and be protected. So protecting yourself from the rain is your job. It is not going to be done by government or anyone else. So a basic mask, hand wash, and a good 6 to 7 feet distance between two people. If that we do, believe me, I'll give you an example of the hospital. We are daily treating corona patients. Some of our doctors are seeing about 100 corona patients a day.
mm,
And still, after 6 months of March to September, now, almost 6 months, most of 95% of them are still COVID negative. We do their
mm,
test repeatedly. Why?
mm,
Because they're just observing these three things: mask, hand wash, and physical distance. That's
mm.
how effective it is. Apart from it, of course, you need to sleep well, you need to take whatever immune booster. But again, those things are, according to me, very secondary. They are not the primary thing. Primary thing is only three: mask, hand wash, physical distance. That's all.
Mm, mm. So, I'm hoping our devotee community really gets your message, because I think that it's very, very important. Tell us, during this COVID period, how many COVID patients have you served during this period?
Uh, in the outpatient, we have served quite a few thousand, but in the inpatient, so we were involved in a municipal or government hospital in our locality. We helped them to set up the hospital. We set up the ICU in 15 days time, which generally takes 3 to 6 months. So all our people worked hard, and of course the government officials and everyone. They cooperated very well, and that's a hospital which is about 200 beds, where we so far we have treated about to 3,000 patients, 3,000. And in
Mm.
our own unit, we also have Bhaktivedanta Hospital's 90-bedded unit, which is about 1 kilometer from the hospital, main hospital. It
Oh.
is called, yeah, which is called as PV Doshi Hospital, which is run as a COVID unit. So there we have around 1,000 patients so far. We have treated them indoors.
Mm. Mm.
And many of them are devotees. We have devotees from Radha Gopinath temple, we have devotees from Juhu temple, we have devotees from our Talasari farm, various devotees from Pune. So some of them
Mm.
were high risk, and all of them have fortunately gone home now.
Mm. Now, I have heard, in fact, this was published by the United States organization called the CDC, the Center for Disease
This is
Control,
yes.
that uh, as much as 1/3 of the people that catch this disease end up having long-term negative effects. What's your understanding of that?
Yeah, we have similar observation. In fact, we have all the data now. We have kept a lot of, we have published quite a few papers also. Uh, so in that, what we are seeing is that the disease is, it looks quite simple. It looks like, some kind of flu, and that may be the initial kind of symptom. But the fever, many people think that I have fever and I have COVID. Now my fever is gone, so I'm okay. That's not true, because the lung injury continues. In
Mm.
fact, after the fever has gone, say from the first symptom, by the day it is sixth or seventh day, that's when the lung injury starts to manifest. And then a person who's otherwise comfortable, but he starts feeling very tired. So he thinks, he attributes it to, oh, I had that flu, so I'm feeling tired and I should be okay within a few days. But the tiredness goes on increasing.
Mm.
Sometimes there is sleeplessness added to that. Sometimes there is depressive feelings added to that. And that goes on till one day he realizes that he cannot go even to the toilet.
Mm.
And that's the time he seeks the medical assistance. And by that time, it is quite late.
Mm.
And many times they go into a cascading kind of event where their oxygen requirement goes to 15 to 20 liters just to maintain a basic level of oxygen saturation above 95. So that's the time which is very dangerous, and some of them then they succumb. But those who come out, also they can take 30 to 60 days to come out completely from the pulmonary problem, this lung problem. So we are seeing now, we have a special unit now for pulmonary rehabilitation, the rehabilitation of the COVID patient, because they take 30 to 60 days to completely come out of the lung injury.
Mm.
So I fully agree with that, that is exactly the same observation that we have, that what looks very insidious and simple can have a very, very long term effect, subtly, and which is not detected by us because we justify thinking that it is flu like illness, so therefore I'm feeling tired. But it is because of actually lack of oxygen.
Mm. Now, I understand something from what you said, that a person catches this disease, doesn't know how strong it's going to be for him, and maybe doesn't seek out medical attention immediately, and then that makes it worse. So, am I understanding you correctly? If a person, and of course we are very concerned about our devotional community, if a devotee gets this disease, they feel some symptom, they need to get to a doctor very fast. Is that correct?
Yes, I would in fact emphasize it and recommend it to all, not only devotees but devotees relations and in general population, that the key to success, because now the disease has been there for 6 months and we know exactly how it behaves. Of course, it is still presenting some surprises, But more or less, we are clear that early detection and not taking any symptom lightly, even though fever has gone, because fever is in our analysis in the initial 500 cases, our analysis was only 16% cases had fever, only 16%.
Mm.
So that means 84% do not have fever. So you cannot count only on fever or sore throat or something like that. There are very subtle lung injuries which are happening even without these symptoms. So early detection, going to the doctor immediately, and anything which is unusual, like some of the patients whom we have treated, they just had an unusual symptom of generally I sleep well, but now few days I'm not able to sleep well. This is the beginning symptom. Or somebody says that uh, I am doing quite well. Otherwise, I have been a healthy body. I have, but I don't know. I'm feeling very tired nowadays, and I just had fever one week back, and it turns out to be COVID. When we do a CT scan of the chest, we know that it is all gone to a next stage. So that's the key. I would agree with you that immediately seek medical assistance. Do not justify it to your own mind that this is happening probably because of this, probably because of that. Do not take any chance. That's the key to success.
Mm. We have heard from a small amount of people, devotees, that maybe this whole virus thing is overblown. Maybe it's even fake. It's causing fear simply so that big pharma companies can manufacture needless vaccines so that they can make money. Is there any veracity to such a claim?
Okay, I will take it very objective to this question because yes, there might be some truth to the angle of money making. There can be, or they may be. But to quote statistics from various sources and say that this disease is fake, which is not intelligent right now, because people we have seen people dying. Like I will give you one example, very sad stories, funny stories. Like one of our, we have a health forum of social people who are connected with Freedom from the community and also to broadcast what the hospital is doing. That is called as a Bhaktivedanta Hospital Health Forum. Now, one of our very, very prominent person in the health forum, he was a Muslim person. Uh, his father got admitted for COVID, and he was 53 years old. And we told him, his name was Mohammad Babushir. We told him, "Ki, see, your father is positive. Just make sure that you keep physical distance." But he didn't listen to our doctors. He was very sort of emotional about it. He went and hugged his father, and he was all the time with the father. And then the reality is that within few days he got the disease and he passed away. Very healthy man. So when we see patients like this, we have seen our own Bhakti Charu Maharaj, which is a emotional trauma to me personally, because I felt I couldn't do anything for him. We have seen these kind of cases, and we cannot just say this is a fake virus. See, whatever the theories of conspiracy are behind this whole vaccination, pharma, that may have some truth in it. But the reality is that people are dying, people are getting affected. We are seeing as doctors every day, we are treating patients. That cannot be fake. So why do we rely on some kind of a data from the websites, and why can't we see the personal experience? We have seen so many devotees who are getting affected. They literally come out of the uh, mouth of death, that we are seeing. And then when we make statements which are saying that this is total fake, there is no need of mask, there is no need of all this, just don't bother about it, we are causing a lot of harm to the not only devotee community, because we are, as devotees, some of us are very prominent, people take our words very seriously. So I have seen devotees sometimes making video and mocking the whole thing. That's very risky, because people will become casual and then they'll become casualty.
So I thank you for that. One last thing on the COVID question. And I think maybe this has something to do with psychology also. Uh, all of the social distancing and the wearing of masks, it at a certain point becomes tiring. And one might start to feel a little bit just like complacent and not take it quite as important. And it seems to me that part of our duty as devotees is to stay healthy and to protect our fellow devotees. And we just have to do this for a longer period of time. Is that correct? We're just going to have to keep doing this until which time things settle down.
Yes, I fully agree with you, Prabhuji. That is the issue. In fact, I keep on telling, be fanatic about it. That's the word I use. Be
Okay,
fanatic.
so we should be fanatic about it. Okay.
Absolutely be fanatic. People may laugh at you. What are you doing, Gopal Bhatta Prabhu? What is this? You are a healthy man. I am healthy. Let's hug each other. No, we have to be completely fanatic about it. Even though, see, the somebody may be very close to you. In spite of that, you have to behave the way it is expected, because otherwise you are not only putting yourself to risk, but you are also putting the other person to risk. Not only that, you are also sending a message to the population that this is okay to do like this. So as devotees, we are generally seen as leaders in the community. We must behave properly, be fanatic about it. That's my statement.
So before we just move on to a couple of other points, anything else on COVID that you would like to tell us about that maybe I didn't ask?
Okay, one incident which I related to Gaurang Prabhu the other day is that, many devotees, they are yogis also. Many people do pranayam and various types of deep breathing exercises. So somebody has COVID, we should be very careful about it, because we had one incident. One devotee, not exactly an initiated devotee, but a devotee like person within the devotee circles. And a young man, he was always a yogi, and he got COVID. So he was admitted in our COVID unit. And then uh, he kept on telling the doctor that I will beat this virus, and I am quite fine and I do pranayam. So doctor kept on telling, right now don't do this thing. We will tell you when to do, because lung is injured. So he in the hospital was quite okay. Then when the day of discharge came, the 10th day we discharged him. So immediately he went to the washroom, shaved nicely and very fresh, wore his home clothes, and he was sitting on the bed waiting for the nurse to come and give him discharge card, etc. And right there he was so impatient. He started doing his pranayam, because he said, I'm already discharged. No one can question me. So right there he started doing deep breathing, Anulom Vilom. And the minute he started doing something called as Kapal Bhati, which is like, you push the air as the pneumothorax which occurred. And on the spot he became serious. And we moved him to the ICU. We had to put in a tube to take out the air from the lungs. And then another 10 days in ICU. So these are the things which are, which we should be very careful right now. Let us not be sort of extra smart on this. Be cautious. People may laugh at you that you're too cautious, but that's okay. We should appear as if we are fanatic. There's nothing wrong with it. Be extremely cautious. That's what I would say. So pranayam, etc. also you should take care. That is one thing which I want to add.
Okay, very good. Thank you. Let's just go spend a few minutes on the medical care of devotees in general, because of course we all suffer from some malady at a certain point in our life. Certainly common diseases, diabetes, high blood pressure, several things like that. Tell us about the care that you offer devotees when it comes to these common maladies.
So, as far as the common maladies like diabetes, heart attacks, strokes, cancers, these are the common things which devotees go through. And most of these are classified as lifestyle diseases. So one thing which as devotees I would like to say is that after 50 they should have regular health checkups. That's one. Then another thing is that do not justify, that because I'm a devotee, nothing will happen to me. Because sometimes we think like that, we preach like that. Like for example, if you tell a devotee to do exercise, which is a part of the daily need, that the devotees may justify, I daily morning I raise my hands and dance in front of the deity. But that we are doing only for 1 minute or maybe 2 minutes maximum. Or sometimes that also we don't do. So, justifying those things. So, regular exercise is a must because it is a lacking thing in the devotee that I have seen. Most devotees do not exercise. So, exercise is a must. A diet which is good, say balanced diet, not too much into sweets, not too much balanced diet. Of course, that dietitians can tell you, and there are many things available because we are famous for prasad, so that we should be careful on that. Sleeping well, and another thing is the dealing with our own stresses. Because as devotees, we give lectures on stress, but we are always stressed out. So that is also true. That I have seen many devotees are stressed out, but they are giving lectures on the stress, how not to get stressed out. So dealing with our own emotions, because we are not only have physical body, but we have a subtle body of mind, intelligence, and false ego, which also have to be dealt with in a very mature way. So in case we have issues with our mind, we should consult a psychiatrist. There's nothing wrong with it. So many things are there. I don't know whether this much time is sufficient to tell all these things, but my baseline would be regular health checkups. Do not justify things in your mind, and just make sure that you are sleeping well, you are handling your stress quite well, particularly those who are leaders. They have a lot of stress, and there should be some mechanism to deal with that stress. And if you cannot, then we should actually get counsel from somebody. So these are the few things I would say which are important. And exercise, again, I would emphasize, most devotees don't do exercise.
Now, some of these common diseases, let's take blood pressure as an example. There are, of course, things that you can do to lower that you might call natural, less salt, number of things. But you can also, it seems to me that some of the medicines that are available have an awful lot to do with controlling it and containing it. Is that true?
Yeah, again, there is a misconception, popular misconception among devotees that allopathy is bad. But allopathy is a boon. Allopathy is the only medical branch which can deal with your emergency issues. There is no Ayurvedic treatment for heart attack or stroke or anything. And so we have to take care of whatever is required. Do the needful. That was Prabhupada what always said. When Prabhupada had pneumonia, he also did not like much allopathy, but he took penicillin. That's what I read in the Lilambe. So similarly, if we have blood pressure, just to justify or convince our own mind that I don't need any medicines and I'll just do less salt and we do not monitor it, and then we'll end up with some complication. So we should rather take medicines, take help of a modern medicine, take help of naturopathy, allopathy, Ayurveda, whatever pathy, but make sure that you are being monitored and you are regular in your checkups, and do not be hesitant to take even allopathy when it is necessary. If you can avoid it, you avoid it. But if it is necessary, do it and prove that you don't need it and you discontinue it. Don't discontinue it thinking that from today I will do yoga and my heart attack will reverse. No, you will die. Let us be very clear about it. First, you put the stent, make sure that the arteries are functioning well. Then you go back to your non-oily food, yoga, this, that, exercise, and maintain it at that level. Because many people, they have angina, for example. What they do? Now from today, I will change my diet and I will do yoga. It is too late, sir. You can't go that way. First, you treat it. then you prove yourself. Ki now doctor is saying I'm completely okay. Then I will stop it. When the doctor says, this is what I would say.
This is very, very important advice for the devotional community. I thank you so much. Your time has been very valuable. We're getting to the end of our time. I certainly am feeling very, very encouraged with your advice to the devotional community. We're going to take this video and spread it as far as we can. And if you don't mind, I would like to come back to you maybe in another 6 weeks or so and have another session just to see how things are going. I, of course, feel, and I'm sure you are, very concerned about India right now, because India seems to be on a very strong negative trajectory of increased COVID. Yes. And I feel that our Indian Yatra, which is the biggest yatra in the world, we need to encourage these devotees to be safe so that we don't have all this illness. So yes. I think if we do another session sometime soon, I will ask our people to make sure that the Indian Yatra gets, every one of them gets this video so that they can watch it. Just what a wonderful devotee you've been. What a wonderful devotee you are. I mean, you have helped so many people. Like I said, you're the current day Murari Gupta. So thank you so very much.
Thank you, Gopal Bhatta Prabhu. Thank you very much for this opportunity.
All glories to Srila Prabhupada. Hare Krishna.
All glories to Srila Prabhupada. Thank you.